Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
So welcome to the Healers Café, and I'm here with Dr. John Dempster. He's a naturopathic physician in Ontario, so board certified, and he is also practicing functional medicine, is the founder of the Dempster Clinic, Center for Functional Medicine located in Toronto. I think that's about all I'm going to give, and all the rest we're going to discuss together. But before we start, well, welcome. And what got you interested in the first place in this whole, field of natural medicine and natural solutions?
From a young boy, my parents told me that I always had this interest in medicine. I came from a pretty normal background, small town, Northern Ontario. And my dad was a dentist. His dad was a dentist. Kind of thought maybe I'd end up being a dentist. But then at the age of 13, I'm the oldest of 4 kids. And we lost 2 uncles within a year of each other to chronic disease. And we were a pretty normal family growing up, having hamburgers and having hot dogs and, just doing what kids do. But when my parents saw their brothers die from chronic disease, going through the standard of care that they were going through, taking the medications, taking the chemotherapy, and we coming to them saying, well, how come they didn't get better when they took their medicine? They didn't have the answers for us. But I'll never forget this. Suddenly, about months after after my uncles had passed, we were suddenly now drinking carrot juice before dinner and taking a shot of cod liver oil before breakfast. And I noticed just some changes like that. And as a teenager, you're like, this sucks. We don't want to be drinking that stuff, reading that stuff. But my parents were strict, and they said, no, this is what you're going to do. And, back in the 80s, this is the best that we had in terms of information. There was no internet. They were just learning on the fly through, magazine articles and books and things like that. And lo and behold, I noticed during my high school years, my parents were doing great. They were not getting sick. They were excelling in their athletics and my dad's career. And my siblings and I were kind of doing the same in school with athletics and academics. And we just didn't get sick. That there could be a lot of reasons for that. But I kind of remember thinking, wow, I wonder if it has something to do with what is going on, because we talked a lot about nutrition in the house, and we were kind of that family that was buying food at the health food store, which again was kind of weird to do back then. But fast forward, my passion and interest in medicine was still there. I didn't know any different at the time. I still wanted to be a medical doctor. And I went and did my pre-med degree. And then while I was doing my pre-med degree, I noticed a lot of my electives were clinical nutrition. I kept picking up these courses and doing my undergrad and taking a lot of clinical biochemistry and nutritional biochemistry. And then a colleague of mine were chatting, and this guy, was also very much interested in medicine and applying to schools. And as we were kind of getting our resumes together and our applications together, he said, wait a second, you love this nutritional stuff. Have you ever thought of naturopathic medicine? I was like, well, what's that? Never even heard of it. Never even seen a naturopathic doctor. Nothing existed in our town. Never even heard of it. And, but I kept, it stuck out to me. So I kept it in mind, and I kind of looked into it a little bit, but I was like, I'm not so sure. So I'm literally applying, dropping off my applications. And it just dawned on me that, wait, no, it's not this. Because I kept asking the medical schools. I said, tell me about your nutritional program, because Hippocrates is the father of medicine, right? Yeah. That means that we should be talking about nutrition in med school, right? There would often be silence on the end of the phone. And at best, I heard one answer, and it said, 4 hours. I was like, great, 4 hours a week? No, 4 hours in your entire med school career. I was like, wow, that's interesting. So that was a big impetus for me to take the plunge into naturopathic medicine. And as I was doing, and I didn't look back. I will say at the beginning, I was like, did I do the right thing? I'm not sure, but I just kept following my passion, which was a lot of the, the science, the evidence-based, the clinical nutrition, which is there. Anybody who says that there's no science to naturopathic medicine isn't doing their homework. And I've kept refining it, but I was very much interested in really personalizing programs to people. And this is where my interest in functional medicine became apparent. And as I even graduated and started my practice, I immediately went and became board certified as a functional medicine practitioner. And I was in a room of 80 doctors, all of which, well, I should say, except for 4, were medical docs. It was me and 4 others were either NDs or chiropractors. And it was amazing going through this, because the beginning of functional medicine, of the fellowship, there was a lot of stuff that we'd already learned in our 4 years in naturopathic medicine. And the medical doctors' eyes were like this. They were like, this is fantastic. And so I just love the synergy. I love the energy. And to this day, I am very, very pro integrative medicine. I love bridging the 2 worlds together, bringing Western medicine and naturopathic medicine together. And to me, functional medicine is a big key language for that. It's a big way to communicate. And, we still have we're not there. There's still a lot of divisiveness in some of these camps, but my passion is to continue to bridge these camps so that the patient can get the best of both worlds. When I first started practice, patients would come to me sheepishly. He's like, can I tell my medical doctor I'm seeing you? I'm like, yeah, I kind of hope you do. But of course, that doesn't always, bode well. And
no, exactly.
Same with naturopathic medicine. There's a lot of NDs that are opposed to allopathic medicine. And I think there's a time and a place for both. And we need to all realize that and really understand that it's about treating that patient. And we have to do our very best to always assess the needs of our patient that way.
Mm-hmm. But I do agree with you with functional medicine. It's like a language that sort of makes sense. It's different than trying to explain, as in naturopathy, though there is plenty behind it, how Chinese medicine works, or how, well, let's not even go to homeopathy, but it's or nutrition just alone, right, as a concept is much harder for many MDs. But I mean, a lot of my patients were MDs, and they're coming for naturopathic care because they're tired of almost peddling drugs without the expectation of a true solution of the root cause. They're seeing it like, oh, this is more like, it'll help you, it'll calm things down, you'll feel better. All of this is true, but it doesn't necessarily get to the root cause, right? And so it's been very interesting. I love being the bridge as well. I think that's really very important. So what is it about functional medicine that, let's go into that a little bit, because not everyone knows what that is, and your passion for it.
Well, what draws me to functional medicine is that I'm also very keen on, as science and technology evolve, I love to make sure that our profession is evolving too, and to the best we can. And what I really like about what functional medicine brings to naturopathic medicine, and there's some very big similarities, we can get into that, but the difference is that we're now using some very current testing procedures that are going to allow us to gather data.
Yeah.
And it's not that we don't learn about testing as an ND, but it's very limited in our schooling. And so I was very curious about, okay, how can I gather as much data so that I can customize a program? I still don't want to be doing a cookie cutter approach, but just using vitamins and diet. I want to make sure I'm treating that person, not the label that person carries. And so functional medicine to me really allows us to start to peel those layers back and get super deep into understanding different types of nutrient deficiencies, for example, different types of microbiome imbalances. It's one thing to say, oh yeah, you've got a parasite by looking at somebody, but that doesn't always bear true. We've got to dive in there and really start to understand, do we have imbalances with parasites or bacteria or yeast or fungus overgrowth, possibly even viruses? Do we have any signs of intestinal permeability showing up? Do we have any signs of SIBO? These are all questions that don't usually get asked by a standard approach right now. And I say that with all due respect, it's just not part of the existing training that a lot of the MDs are going through. And that's fine. So that's a big part of our conversation when a patient comes to me, is that we start looking at those things. We start saying, okay, are there certain toxins in your environment that maybe you've been exposed to? Are there certain hormonal balances that might not have been detected? These are all parts of the conversation that we'll often bring to the table.
Mm-hmm. Well, I'm very tempted by the thoroughness of it and the individuality of it as well. And that's actually one of the first things I did when I graduated 30 years ago, is take a functional medicine course. And like you said, there were chiropractors, MDs, and maybe one or two NDs, because we were taught it, but not to the degree that this can actually allow you to to find the root cause, but also to follow up and collect data so that we can speak in terms of this is what's happened, and we can then show results no matter what modality we use. So I think that's how I saw it a little different, is naturopathy offers modalities that can get beyond nutrition, also nutrition, but other ways of getting to the end results. And functional medicine allowed me to test that it was true. That's how I used it. Do you want to comment on that, or how do you see that?
Yeah, first of all, I think you're absolutely right. We have a lot of modalities at our fingertips as an ND. And I think that's a pro, and I think it's also something we have to be careful of so that we're not too diluted. And so, that's why I think a lot of NDs will hone in on certain modalities and become experts in those modalities. As you know, we cannot call ourselves specialists in anything, but we can really hone in and become have a strong focus in an area. And that to me is what drew me, again, more into the clinical nutrition, into the biochemical side of things. That's my interest. That's my strong expertise. Is there a time and a place for acupuncture? 100%. We have one of my associates in my clinic is an absolute expert in acupuncture, and she's fantastic. And anything that's been around for 1,000 years, we don't need to run RCTs anymore. That's been around for 1,000 years because it works.
Yeah.
And excuse me, yes, we still need to run RCTs. But the point being is that that's the test of time, and so that there should be some merit to that. Same with homeopathy, same with lifestyle medicine. These are all very, very important modalities. But every ND has their own little language that they speak and their own passions. And I think we have to draw upon our passions to excel in a certain area.
Yeah.
And that's why, it's such a great profession in a way, because we're so unique. But we also have to be careful that we're not so diluted in different directions that we don't have this cohesion as an entity and as a community.
I think that's a real risk, but it makes us almost like general MDs. It's like, then, I actually taught homeopathy at Boucher for, 10 years or 12 years. And it was interesting. What I would tell my students is, you've got just about enough knowledge to not actually take on chronic cases and know to refer to somebody who goes full in on homeopathy, because knowing a little bit about it isn't practicing it fully. It's like knowing it exists. And I'm not saying don't give arnica or obvious things that may come up, but to get good at anything, it's the same. I love Chinese medicine, but do I practice it? Or did I? Sorry, I got to do everything in the past now. Did I practice it? No. Did I use the knowledge of understanding of it to do even Bowen therapy? Absolutely, because it's a body of knowledge. But to say that I'm an expert in acupuncture, no, unless I was focused on it. So I think, it's a very interesting thing, our positioning as naturopaths. It's not enough to say, oh, just go see any naturopath. It's like you almost have to have what is it that you want to, not just, what modality are you aligned with, or what do you believe as a client or patient?
Mm-hmm. And that's why we all hone in on generally speaking, will attract certain types of patients.
Exactly. Yeah.
I work a lot with autoimmune patients. About half of my practice is autoimmune, and another significant portion of my practice is digestive related issues. So that's a big part of what I attract, probably based on the way I communicate and based on the trainings that I've been through.
Well, I'd love to talk about the cup, but also because autoimmune problems are definitely on the rise.
Mm-hmm.
what would be like the approach to somebody who would come to see you? How can you walk us through, or a case that you know, but without names, obviously?
Yeah, I think this is where functional naturopathic medicine have a real powerful window to shine. It's not that we possess a cure for any condition, but oftentimes the more we're learning about a certain autoimmune condition, there's over 220 diagnosable diseases right now that fall under that umbrella, and that might be a very conservative estimate. But what we're seeing is that this is often a result of a perfect storm or a hurricane of symptoms that have, or its underlying causes that have been out of balance for some time, that create this almost synergistic wave that creates this reaction, this catastrophe, if you will, of symptoms. Because if you're thinking of, think of Sjogren's, or think of lupus, or think of Hashimoto's, that's fine. They're generally speaking, Hashimoto's is attacking the thyroid. I understand that, but how did that happen? We now have to talk about what's going on with stress, what's going on with reactions to certain foods in your body, which is massive, what's going on with the integrity of your gut lining and the microbiome in your gut, what's going on with nutrient deficiencies, has there been any exposure to heavy metals? And that's just a small start to what can cause Hashimoto's. Nonetheless, what's going on with their genetics and so forth. So we have to now unravel this almost like a layered onion. You have to just start peeling these layers back and start to understand where those little blind spots is how I communicate with my patients, things that we can't see on the surface that might be festering and fanning the flames. And so autoimmunity, in more cases than not, is not caused by one thing that I've seen. It's by a number of imbalances. And what we aim to do with our patients is really try to help them leverage and find where these blind spots are, eradicate those, so that we can leverage the healing processes in our body.
Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com tips. Thanks so much.
By removing some of those obstacles. There's an old saying by one of my mentors that I love, Dr. Mark Hyman. He used to say, look, if you step on a thumbtack, it doesn't matter how many Tylenol you take. You still got to take the thumbtack out of your foot. You can manage the pain. But until you actually remove that thumbtack, you're not getting ahead. And so this is why I think we're seeing in a lot of the cases with autoimmunity right now, if we're not taking an integrated approach, we're going to be on stronger and stronger medications. And I've seen that many times. And like I said from the very beginning, there is an absolute time and a place for Western medicine, and specifically with some of these chronic diseases. We do need some help at times. And at times, patients have done great without them. You have to be patient-centered. And this is also what my passion is addressing the needs of that patient. If they're in chronic pain, and they can't work and they can't walk, maybe we should work on getting that pain reduced somehow, so that at least we can get a quality of life while we're chipping away at the root cause. Because as you and I both know, going at a root cause resolution pathway doesn't happen overnight. This often will take weeks, months, and sometimes well over a year to fully get those blind spots addressed and removed. So it can be a lengthy process. And for that person to be sitting in a wheelchair, per se, in so much pain that they've lost a life of not doing anything, sometimes we do need to make some concessions, and I do allow that symptomatic approach to be part of their therapy.
For sure, yeah. I was wondering if you have yet, because clinically it's not very evident yet, but there's talk about a potential, one of the effects that a lot of people are receiving, which is like an AIDS-like syndrome, which is an immune disorder, obviously. I would imagine that how you come into it is going to affect also how you might be able to get out of this conundrum. When your immune system is weakened, I would imagine that, it's like everything else, your health to start with will be one of the determinants on how easy it is to to deal with any other trigger to your immune system. Is that, have you had any cases yet of this? Or I know I did way back, but that's another, another time
Speaking
period.
of AIDS as we know it, is that what you're speaking of?
Yeah, like it's one of the side effects that people are noticing from the therapies that are in use right now to deal with the pandemic.
Yeah, I'm not sure I can comment on that. I haven't seen, anything that would stand out to that regard.
No.
Do we work with people with immune issues? We always have, and we always will.
Right.
I can't say that I've seen anything that would suggest that this is as a result of something, different in the last couple of years. Not to say that it's not there. We see people that are sick every day, and I've been doing this for 15 years.
Yeah.
And so I haven't necessarily seen a change in that, if that's what you're asking.
No, yeah, I would imagine not that it wouldn't come up yet, but I'm thinking more on a positive note that that the body can deal with this. If you're having the same approach, it doesn't matter whatever whatever the extra thing that tips the tea, like, what's the expression in English? Your cup is full. If you have one more thing, it overflows, right? So I would imagine that the approach to any immune disorder, because I think there's quite a fear that there will be more immune disorders, is the same approach you would take 30 years ago as you would take now, as you would take, in the future. It's individual, and it depends what's in your cup to start with.
Well, yeah, there's so much we can do to help support an immune system, and that's not to say that there's not a role for anything else. I won't go down that rabbit hole.
Oh no.
But what I was going to suggest is that, yes, I mean, if we're trying to improve somebody's immune system, we should be looking at the gut. The gut is where 80% of your immune system lies. We should be measuring, not just throwing nutrients, but we should be measuring nutrient levels to understand truly what that person needs. This, to me, is all part of an integrative, complementary approach to an immune protocol.
Yeah. So how would you do that? Because I mean, I think most people know that the immune system is largely in the gut, but how would you, again, let's say if I didn't know that I had gut issues, how would you approach it, and what do I need to know myself to suspect that maybe I could get help by somebody who does functional medicine or is a naturopath and does it? Like, what do I need to know?
Well, I think the first thing is you don't need to be sick to seek the care of an
Okay.
or a functional medicine doc. I've alluded that a large part of my practice is disease oriented, but there's another group of my patients that are fantastically well and healthy and want to remain that way. And they want
to optimize it.
And take it to a whole nother level. They may have seen something in their family trends that they're a little bit concerned about, and they want to take action. But what can they do? Back to your question is if I was to sit down with you as a patient right now, I'd be taking your history, Manon. I'd be actually sending you an intake form, and I'll walk you right through what I do. I would be sending you an intake form days before your appointment that takes you 1 to 2 hours to fill out. Not because we want to torture you, because I want to learn as much as I can before I actually meet you in person or telemedicine, before we even meet. And so it's a very thorough questionnaire on your medical history. And we're looking for all these little clues, almost like little breadcrumbs, that are going to start to lead us down a conversation point that could somehow reveal these blind spots. And so that questionnaire is not to diagnose, but it's rather to give me an idea. Okay, so where do I need to focus my workup with somebody? We have a number of different labs at our fingertips. So not every patient is going to get 140 different tests done on them. We're going to be very selective about that. But if you came to me and you were worried about your immune system and you were suspicious of something that was going on in your immune system, I would be highly recommending that we measure how your gut is functioning. Whether or not you have digestive issues is beside the point. It would still be very prudent to know, do we have enough of our good bacteria? And there's a number of very key strains that we can analyze using certain labs these days, using a 3-point or 3-day stool analysis. And this is very different than usually the traditional stool analysis. Sometimes these ones that functional medicine practitioners utilize will go down to labs. Often they're in the States, there are some in Canada, but they will give us pages of data. And it's not that more data is always better, but sometimes we do want to look a little bit more in depth, especially in these areas. I would also be measuring your nutrients, Manon. I'd be making sure that not just vitamin D and B12 get measured, but all the other 32 main players that are often significantly involved with the immune system. And we'd be looking to specifically identify if you had any massive deficiencies that could be in your way as hindering your own immune system to function. We'd be talking about how are you managing stress. A lot of us have been through a lot, not only our whole lives, but through the last couple of years especially. If cortisol, which is one of your main stress hormones, is chronically elevated, it's going to suppress your immune system for time after time. And we're meant to have short bursts of cortisol, but if we're having these constant bursts of it, we don't have this recovery time, then we're going to be a little bit more exposed, or a lot more exposed. And that's just to name a few things. But again, it'd be very specific according to our meeting and our intake with you, how we would go down.
Mm-hmm. And where do you see because you mentioned stress, and some people believe strongly that if you can manage the stress, mentally, emotionally, and all those levels, it will impact the way your physiology, the way your body responds to stress. When do you refer people, or do you refer people? Like, is there a limitation to the nutrient, like getting rid of, all the nutrient deficiencies, rebalancing? Like, have you found that is enough for again, I know we always attract our types of patients, so it's a caveat I'm putting in, but have you found that people need also sometimes more to be able to deal with their gut health, for example, or their immunity? It's all the same in the end.
Most definitely. We talk a lot about the pillars of health with our patients, and the pillars of health are eating right, thinking right, drinking right, sleeping right, de-stressing right, and pooping right. And so those are just to name some of the big ones. But, if I have somebody who's dealing with some trauma, emotional or some form of trauma that has not been resolved, whether it's continuous or in the past, we refer out all the time to therapists and to psychiatrists. We have them get in touch with their MD to get that referral. We cannot refer directly to specialists in Ontario. But that is a big factor. I used to host a summit called the Mental Wellness Summit. And for a while, we were the largest summit online for helping people understand alternative and complementary ways to help support, anybody going through anxiety, depression, schizophrenia, et cetera. And we would interview some of the top doctors in the world taking this complementary integrative approach. A lot of them were MDs, PhDs, psychiatrists, and so forth. And so that's a big part of my referral system. Same with a lot of the anatomical imbalances. If we're dealing with any form of, we refer to a lot to osteopaths and chiropractors, because again, biochemistry, as you were kind of alluding to, can nutrients take you all the way? No, they're one cornerstone. We've got to make sure that all these cornerstones are set in place for true healing to take place. And it's just a big cornerstone that tends to get overlooked. So that's why I focus on what I do. But all the other ones are equally important.
Yeah. Well, of course, I share the same opinion as you, but I just thought I'd check because of your focus. But it's one, for me, I discovered something. I eat lots of greens. I eat what I believe to be well. And I did a test and I'm vitamin C deficient. And it's like, how on earth is that possible? And so I got my I guess I shouldn't say anything, otherwise it gives people too much information. Let's say a relative in general. And it was there too, right? And then it's like, oh, okay, now you got to look deeper. What's going on here? Because there's something not happening. And it's not always obvious, even with nutrition, until you test it and then you go, okay, and then vitamin C may be a bit of the answer, but in this case, obviously not, because it's an absorption. There's more to it, right? So it's interesting how all the information helps. Everything about a person, every piece you can get really can help direct their their health in a better direction. So you do telemedicine? You mentioned this, right?
We do. Yeah. We see patients through telemedicine, and I'm located in Toronto. So we still have patients, and we're permitted in Ontario right now to see patients in person.
Right.
So we are equipped to do both. And it's obviously been very different during the pandemic, but it was before that, people would come in from all over the place. But now with travel being somewhat restricted and hopefully opening more up all the time. But
right.
Telemedicine has been very helpful for those that live in a small caveat in Ontario. We can only do telemedicine with patients who are in Ontario.
Correct. Yeah.
So it's we have patients that will phone in or do our video conferencing from all over Ontario.
Yeah. So we'll put your information out so people who are in Ontario can
happy to help. Yeah,
connect with you. And anyway, it was really informative. And are there any last words you want to leave?
Well, sure. I mean, I'd be happy to chat about the gut in more depth if you're interested in that. But at the same time, I always tell people right now who are listening, and I speak a lot on summits where there's this avalanche of information of things to do and takeaway steps of things to do that it can be very overwhelming. If anyone right now is listening and thinking, wow, and we haven't really got into too much treatment stuff today, but just in general, the more we're learning and absorbing about being healthy and well, it can be very overwhelming and intimidating. I say, look, it's not about perfection. It's about progress. Just do one thing better the next week than you did the previous week. Let that have like a compounding interest-like effect. And over time, you will see a significant change, and it'll be sooner than you think. So don't think about, changing everything at once and having everything happen all within a week. It's going to take some time. And what I love about functional medicine is it can provide you maps that are going to help you get to the end more efficiently, take out the guesswork, reduce the guesswork as much as you can, and just allow this process to be less overwhelming and less shotgun-like approach, like shoot in a million directions and hope something sticks. We want to really try to tailor this to the person. So don't be afraid to be feeling overwhelmed right now. Just know that you don't, it shouldn't be a crippling procedure. It should be something that is very invigorating and inspiring, saying, yes, I can become an advocate for my health and get things moving.
All right. Well, I'll leave it right on those words. And thank you very much for your time.
You're very welcome. Great to be here.
Thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website, and discover how to listen to your body and reboot for optimal health.